The 15-year-old patient suffered an approximately 8 cm long, very deep knee injury, caused by a kick with a studded shoe of an opponent during a soccer match. The treating physician, father of the patient, attended to the wound at home without having to visit the practice. After the bleeding stopped, the wound edges were adapted by stretching them in the vertical direction, and Epiglu was applied directly from the vial, which was the former package of the adhesive. Anesthesia was not performed and is generally unnecessary. It can be seen clearly that the wound was first closed, and Epiglu was then applied extensively to the surrounding area as well. It is important to avoid any contact of the pipette tip with the wound during the treatment, as the pipette may adhere. The treating physician in this case is an experienced Epiglu user and applies the product directly from the vial. It is strongly recommended, however, that beginners initially apply Epiglu with the dosing pipettes. Here is the treated wound immediately after Epiglu was applied. Approximately 5 minutes later, when the material has completely hardened, the patient can be released. The patient was absolutely free of discomforts, took 1 or 2 showers every day, and attended soccer practice again already 1 day after the injury. This put the wound under an exceptional strain, and as a result, the dressing started to peel off at the edges and was broken in 2 places. To re-stabilize the dressing, Epiglu can easily be applied to the breaks and under the detached edges. After 2 days, the healing process is already well advanced. The patient is still free of pain, and because he is not careful with his injury, the wound has to be stabilized again on the 4th day. During the last days, the patient went swimming and to the sauna, and he has also taken several showers each day. Besides that, he attended soccer practice every other day, which caused an additional strain to the wound. The patient is free of discomfort and does not want to pay any special consideration to his injury. Therefore, he breaks off the parts of the Epiglu layers which are detached from the healthy skin. A further readhesion was omitted. On the 7th day, the patient actively participated in a soccer match, during which he repeatedly fell. The Epiglu dressing had gotten very dirty and partially came off. Since the patient did not want the dressing any longer, and the condition of the injury allowed this, the Epiglu layer is completely removed. Normally, the dressing stays in place until the formation of new skin lamella lifts the layer off. The patient is free of pain and the wound shows no sign of inflammation. Any additional wound treatment is therefore omitted. Because of exceptional strain during the healing phase, this wound stretched. Under normal circumstances, this does not happen. Epiglu is especially recommended in cases where minimal scar formation is important. The case shown here is not representative because of the immediate extreme stress applied to the wound, but it shows clearly that Epiglu protects wounds so perfect that they heal even under extreme conditions, pain and inflammation free. Epiglu was used worldwide in many other clinical cases. This CD will be supplemented bit by bit. Meyer Hake Medical Innovations is also manufacturer of the radiosurgical unit RadioSurg 2200. Excisions can have a histological examination up to the wound edges because the tissue does not get heated and the cuts are not discolored or necrotic. RadioSearch 2200 can be used for all kinds of techniques and specific fields in private practices or hospitals. In many cases, it substitutes a laser at a fraction of its price. Please visit our homepage for more information about our tissue adhesive or our radiosurgical units at www.meyer-hage.com. Thank you for your attention.